and I am super excited to be here for the first Polaris Talks in the year 2023. So I would like to wish you all a very happy new year, and I hope all of you will have all your dreams come true this year and even for the next coming year. And to be starting off with Polaris Talk, nothing but the master session with our super tutors, Dr. Ryan Fernandez, Medical Director at Dr. Polaris, and Dr. Sanjit Bajpayee, Chief Academic Officer at Dr. Polaris. Hello, sirs.
Hello, Aishwarya.
Hello, Aishwarya.
Wishing everyone a very happy new year.
Yes, wish you all a very happy new year.
Same to you both also, sir. I hope the new year has started really well for both of you, right?
Yes.
Yes,
Absolutely.
yes. Looking forward for amazing sessions in the coming days as well. So I'll not make it much more elaborated because I know the experts are already ready and super excited to discuss about the most awaited topic ever, that is the introduction to the CBME curriculum. So I am handing over the session to both Dr. Ryan sir and Dr. Sanjit sir. Over to you, sir. Thank you.
Yes, good evening, everyone. So, like Aishwarya said, it's start to a new year, both to a new year in 2023, and we are also we have been in the process of starting the first year for all the young, hopeful MBBS students. And today, I think after a lot of discussion over various important topics, we have reached a topic of interest for this batch, as this batch will always be referred to as CBME batch, CBME batch, CBME batch. Let us be honest, when something new is started, it is the first few batches, for example, in medical courses, it is experimental. Experimental, when I say experimental, it doesn't mean that it is something that will be done and forgotten. CBME is here to stay. Competency-based medical education is here to stay. It is one of the best things to happen to medical education. But over the next few years, I think it will take some time for the whole system to get refined. And that is what is happening. Last batch had CBME, they have refined. And now for this batch, from 2022-23 batch onwards, again, further refinements have been done. So I would directly like to start with an overview of what is competency-based medical education, and like to tell the students what exactly is going to happen in the next 1 year. So according to NMC, competency-based medical education, the batch 2022-23 onwards begins from 15th November officially to 15th December 2023. Now, various colleges will start at various times based on their convenience, but the official year, first year MBBS for 2022-23 batch has begun from November 15th last year, and it will go on till 15th December this year. So there are a total of 13 months, of which they have excluded few weeks. 15 weeks are excluded. So totally 13 months equal to 57 weeks. In that, 42 weeks of teaching the MBBS students of this batch get in their first year. Remaining 15 weeks have been set aside for obviously the sessional exams, for the results, for vacation, as well as public holidays. There are 2 weeks of public holidays. I don't know how 2 weeks of public holidays have been included in the curriculum. But overall, this batch of students are going to have 42 weeks of teaching. In each week, there'll be 39 hours of teaching. So totally 1,638 hours of learning in the medical college is available to this batch of students. This is not my calculation. This has been nicely calculated by NMC and given. So students, you all will be sitting in the lecture hall, going to the wards, and totally you will be sitting for 1,638 hours from your November 15th of last year to December 15th of this year. So all the best for that. So this is from NMC. So this is the NMC document that I'm holding, and it is directly from them. So what is different in this CBME? Why do they keep saying CBME, CBME? What is the what is different. So I'll tell you what was different during our time so that you will know what big change it is now. During our time, we are now talking only about first year MBBS. We'll slowly go on to second year, third year in the coming sessions. So when we joined first year MBBS, like I have told in the previous session, we all thought that we would be welcomed with garlands in the hospital wards, and the nurses and the patients would clap, saying that, oh, the doctors are come to save us here. And then we would go directly to the operation theater, and the surgeon there wouldn't know how to do what is the next step of the surgery. And he would ask us, doctor, can you tell us the next step of the surgery? And we would tell the step of the surgery. So that is what we thought when we joined first year MBBS. Little did we know that for that full year, we wouldn't be going to the hospital at all. We'll be sitting in the lecture hall, listening to anatomy, physiology, biochemistry, wondering how is this related to becoming a doctor and treating patients. So that time we didn't understand what was happening. And looks like the authorities also have realized that, yes, these people didn't know what exactly was happening. Suddenly in second year, they were sent to the hospital wondering what happened to that first year. So that is why changes were brought. And now, according to the CBME curriculum, you will have anatomy, physiology, biochemistry, of course, the three subjects with lectures. Anatomy, 228 hours of lectures, physiology, 138 hours of lectures, and biochemistry, 80 hours of lectures. This is where your professors will come there in front on the podium and teach you for 220 hours in anatomy, 138 hours in physiology, and 80 hours in biochemistry. This is what we had when we were students. We had, now it is divided into 220 hours. We had all the hours. Among those 1638 hours, I think 1500 hours with the professor coming and standing there and telling us about anatomy, physiology, and biochemistry. But now CBME, they have said, no, don't, we don't want 1500 hours of people talking and the rest of the students sleeping, wondering when they will reach the hospital. So they have started another thing along with lectures called as small group teaching. So gone are the days where 150 students were sitting in the lecture hall, like in Munna Bhai, where they're sitting in the gallery, and then Munna Bhai asks a doubt and he's thrown out of the class, where he asks, I think, if I'm not mistaken, Sanchit can correct me, he was asking about ragging, I think. So just like that, question is asked, rest of them are sleeping. Now, you all will be divided into small groups. Groups of 15, groups of 20 each, with one professor or one associate, one assistant SR, and small group teaching lectures will be taken. Along with that, there are 20 hours in anatomy, 15 in physiology and biochemistry for self-directed learning. What is self-directed learning? Learning where you can discuss journals. You can use online teaching programs like Dr.Polaris, the MBBS learning app. So COVID took us to learning at home, and this has now been accepted. They say that you can accept standard, not any other Google based learning, what is put on Google search there, standard teaching apps like Dr. Polaris. So that comes in self-directed learning. Along with that comes something new, which was introduced for the CBME batch, that is early clinical exposure. We'll get into later. Community medicine, this early clinical exposure for the previous batch was 90 hours. 30 hours for anatomy, 30 hours for physiology, 30 hours for biochemistry. I told you every year they are refining the system. So this year they have said we don't need 90 hours for early clinical exposure. 60 hours are enough. 20, 20, 20. So they have reduced it by 10 hours per subject for early clinical exposure. They have introduced the community medicine and family adoption program, that is 20 hours. AdCom, which again Dr. Sanchit will tell you more about AdCom. 26 hours are allotted for this AdCom module. And of course, sports and extracurricular activity, only 10 hours. So I think that is very less, but I'm sure students will find their own ways of engaging themselves in sports and extracurricular activities. And of course, exams and assessment, 80 hours. So this in brief is your first year. What your, most of you would have already started your first year. So you are well on the way to this program. So in your first year, of course, your second year, according to CBME, has a separate set of curriculum, and third year, separate set of curriculum. So this is what you're going to face in your first year now. So I'll hand it over to Dr. Sanchit, who will help us shed light on some of the aspects. I've given you the overall picture. He will give you a rundown on some of the aspects of this competency-based medical education.
Yeah, good evening, everyone. I think Ryan sir gave you a lot of brief about CBME. And this scares me. If I am a student, I'll be scared sitting on the other side. So many hours of reading anatomy, so many hours of reading physiology. What is the end point? Now, let me make things very clear to you. Everybody knows Will Smith, right? Will Smith is a great actor. He has said a very good thing about it. Okay. So he said, no matter how talented or educated you are, your talent or education will fail you if you are not skilled enough. Now, that word skill carries a lot of importance when it comes to medical learning. Now, simply let me state what used to happen at our time, what Ryan sir correctly said. And let me state Munna Bhai's example here again. So when we used to learn, when we used to enter a medical school or a medical, and when we were a first year medical graduate, we were reading anatomy, we were reading physiology, biochemistry, and have no clue what is going on in the hospital. Because what biochemistry is teaching us, Krebs cycle, glycolysis, etc., this, that, carbohydrate metabolism, lipid metabolism. The second class is appendix. Third class switches to cardiovascular system physiology. There is no connection at all of what we are getting taught. And by the end of the day, we don't have any idea that how does this actually help us? Because when I used to go home, I used to question myself, why did I learn this? Or why did I even do this? Or what was the need of reading so much of upper limb anatomy that I can't even remember in my brain? So accordingly, 20 years, this system got satiated. And finally, the lid had to blow out because what we were creating were doctors who are not skilled enough, or rather who know things a lot, but don't know exactly where and when to apply that. And that's where, again, a revision came and CBME, or competency-based medical education, came into being. So what we are facing now is CBME, and that is actually great. So what they have done is they have taken teaching, they have taken certain tools, they have taken certain technology, they have taken some amount of techniques, skills, and they have done a commensurate together. And they have created a core model. Now that model is for you. Now let me be brief here. Everybody has seen Munna Bhai, right? When he was in first year, he gets up in the class and he's talking about a patient and he asks the professor, वो patient को treat करने के लिए form भरना जरूरी है क्या? So that form, communication, attitude is something that medical students lack. You guys will know brilliantly about the upper limb, lower limb, let's say abdomen, neuroanatomy, neurophysiology, everything is on tips. But then comes when you face a patient of stroke, what to do? You will be in palpitations and tachycardia. What has happened? Where is all my neuroanatomy suddenly washed off? Where is that neurophysiology? And that is where CBME comes into play. So what exactly they proposed was that they want to create a doctor who not only has a very good hand on knowing things, or he is knowledgeable, but at the same time, he's a good communicator, he's a good leader, he is ethical, and he is skillful. And when you combine all of these things, then you are a good clinician in today's time. And that is where a lot of reforms have happened. And luckily, you are the batch that is going to face that. And trust me, if you just follow it correctly, step by step, right from your first year till your final year, you will be much more ahead than the previous times. You will be better than us, frankly speaking. Because when we came out, we were not knowing many of the things that actually apply. And by hit and try, we used to learn that. So that actually wasted a lot of time, even for us. But that is made very easy for you. Now, let me define how this model works. So the core model I already told you about, and this model is called as an ETCOM model. Now, what is AETCOM? That is basically attitude, ethics, and communication model that has been added to the learning part. So you have to have some amount of a good attitude towards your patients, towards your teaching, towards your learning, as well as you should be at the same time ethical. So we have to teach you something about ethics too, and the correct way to communicate a patient. So these are the core principles where a doctor comes. Because by the end of the day, trust me, you are going to see patients. And seeing a patient is much more than a disease. You don't have to treat the disease. You have to actually diagnose the disease and treat the patient. Now, how to treat the patient is a lot of mental game, and it involves a lot of things. And that is what we are training you here. Now, when CBME was designed, it had got certain amount of things that they have given definitions for that. Okay, so let me be very clear of what exactly these definitions mean. First of all, whenever you are reading, what is your goal? Your goal is to become a good doctor. Now, let me be very clear here. We are not creating good doctors. We are creating great doctors. That is another dialogue. And what we focus on is also creating future leaders. Because just that difference, see, I'll tell you, you are on a thin bar. You create a mistake, you are a bad doctor. You treat well, you are a good doctor. There is nothing called as an average doctor in today's time. That is that thin bar. And you all have to land on the other side of being a good doctor, right? So first is your goal and what you want to achieve. Now comes what is competency in the CBME. Now, competency means that you know a certain thing. That means you have knowledge. Okay. Together with that, you have skills, you have ethics, you have got values, plus your emotions. And together with that, CBME has been defined and what a competency is and what a learner should have. So a learner should have all these skills. That is not me defining competency. That is how NMC defines competency. That a learner should have everything. A doctor should be, a dairy milk chocolate, which has got all the flavors. So this is what CBME is. Now, there are certain domains of CBME. And that is even, you'll find it into your logbooks. And in your logbooks, you will have certain symbols written over it. Now, Ryan sir will be talking much more in detail what your logbooks are and what exactly your logbook filling will be and how will you fill those logbooks. But let me get things a little clearer here. Your whole system of learning is upon a model. Okay. So I am also a part of that model. Ryan sir is on a part of that model. Everybody is a part of that model. Okay. So how they came up with this idea. So there is a model called as Dreyfus model. And they have followed it clearly in CBME learning. Now, what is that Dreyfus model? Now, once you have entered in your first year, you are a novice. That is stage one. Okay. Once you will cross this first year and keep on going till your final year, you will become an advanced beginner. That means now I know certain things. So now I'm an advanced beginner. Third stage is, as soon as you finish your medical education as a graduate, MBBS is done, you will become competent. So after MBBS finishes, you are on the third stage. Once you will go into a post-graduation, you will become a proficient. That means once I finish my post-graduation, still I'm learning, still I'm in that phase. And the last one is, once you enter into your consultancy, you will be an expert. So till the third stage, you are there in your medical college to become a competent graduate. And what it takes to be a competent graduate, it takes everything to be a competent graduate, not just books and books and books and learning. Because frankly speaking, if you see Dr. House, right, he just sits back. Now, have you seen Dr. House just of one profession? He's a medicine guy. But when he runs his brain, it is in 10 different domains to actually diagnose. He runs into biochemistry. Sometimes he goes for a panel. Sometimes he tells to do an MRI. Sometimes he tells his student to do a surgery. Why? That is in simple CBME. His mind is in different places at different times, and he is getting that diagnosis on table. That is what a doctor is. So your lateral thinking has to be wider, right? Fine. Now let me come to what exactly CBME is all made up of. So as I told you, it has got three important domains. Now, when I say domains, these three domains have been defined by CBME as a student should know, or his learning should be oriented towards three domains. The first domain is knowledge. That everybody knows that I am knowledgeable, Rance is knowledgeable, you are knowledgeable, everybody is reading. Now, what does knowledge mean? They will give you a certain amount of questions. Now, your whole MBBS curriculum has been divided into competency levels, right? From one chapter, second chapter, third chapter. Suppose you're reading anatomy. Anatomy has, suppose you're reading about general anatomy. Now, general anatomy has got two competencies that you need to know. At the same time, suppose you're reading abdomen. Abdomen, suppose you're reading a chapter on liver. Liver anatomy has got three competencies that you should know. So they will write down there that competency, a subject, that means a brief of the subject. That means anatomy is AN. Suppose that is a brief. Physiology PY. Then dot some number. That is, this is the first competency you should know. That is knowledge. That means you should know that. In short, I would say it is a question bank for you. Ready-made. Because if you just keep that, you keep on ticking it, the same way will be your questions that will be in your exams. Because they have straight away told you those questions in a brief. They will say enumerate different types of grading systems, suppose in tonsils. So that is enumerate. And they have given you that question. So you need to know that question. That is knowledge, right? So that is the first thing. Now, knowledge, they will give you certain terms. Sometimes they will say list. Sometimes they will say describe. Sometimes they will say enumerate. Sometimes they will say describe. All of this comes under knowledge. These terms are for knowledge. That means you're reading them. Now, the second thing will be somewhere they have written S. S stands for skill. Now, here is where CBME is very new. Now, what is skill? Skill means identify it, demonstrate it, perform it under someone's supervision, or perform it individually. That is a skill. Suppose I'm learning, like I tell you, suppose I'm learning about anatomy positions, okay, anatomical positions. Now I know about anatomical positions. That is my knowledge. But once I go to my lab and my teacher tells me that, okay, you stand up and show to the class that what are the different anatomical positions. That is a skill. That is something that you are performing under someone's supervision, and then maybe performing independently. And if I'm not wrong, Ryan sir, still we are a part of CBME because till date when we do surgeries, till date we have got supervision over us and then we do it independently. So you are a part of the system now. That is what exactly the system all means, and that's why I told you that model, that we are all a part of that system till our grave. And this is what defines you, being a good doctor. Now comes the third part. So you are knowledgeable, you know how to do certain things, skill. And the third part is attitude. Now, what is the attitude towards problem solving? How is my attitude towards the patient? How do I go directly and communicate to patient? How do I break a bad news? Now, I know this is a patient of stroke, so I have to go and break a bad news in front of the patient party that this patient is suffering from stroke. How do I do that? There are certain techniques to it, right? Now, how will you understand that? If suppose you understand neuroanatomy well, you finally got to know about how the brain works through neurophysiology. Then finally you understood about a certain disease that is disturbing the neurophysiology, and that disease has hampered his living. For that, you have to communicate to the party. This is how integration works at different levels. And I'm going to talk about integration as well, that what is horizontal integration, what is vertical integration, and that is how we have even designed our app. So I think we are the only and the first app, and we are very proud of that, who has been designed in the way doctors should learn. We are not here to make you mug-ups or just open textbooks and read. We want you to have that kind of a lateral thinking. Suppose if you're seeing a patient if you're reading facial nerve, you should know about how a patient looks of facial palsy. You should know how to talk to a patient of facial palsy, what to tell a patient of facial palsy. That's how it is, right? So this particular CBME is not something that is teacher-centric. It is more that is student-centric. It has got students together to know what to do, when to do, and how to do. And that is what makes you a better doctor. Now, whenever you are learning certain things, there have been certain symbols also that has been given to you that Ryan sir will discuss with you in your logbooks. But I'll just brief them. All your CBME has been made by something called as a Miller's pyramid. Now that Miller's pyramid has got certain levels of competencies. And you will see these kind of abbreviations in your logbooks as well. So somewhere it will be written as K. K means that you have to know about this certain thing. That is K. That suppose I tell you that histology of liver. So you should know about histology of liver. That means you have to read it, right? That is the histology of liver. Now somewhere you must be seeing that symbol KH. KH means knows how. That is the second base of the pyramid. So first is you should know. The second part comes knows how. That means KH. That is the second abbreviation you will see in a lot of competency that has been given to you in your logbooks. Now KH means knows how. What is knows how? That means I know about the histology of liver. Now I can describe and analyze certain diseases that can distort the histology of liver. I can analyze that part. That is called as knows how. Right? Now somewhere there will be an S written, and we already discussed that is a skill. Now skill is again divided into, one is S means show or shows how. Now what does this mean? That means a particular skill will be given to you. That can be anything. Let's suppose you're in a biochemistry lab and a person is telling you, okay, you tell me the steps of this particular test. That means he's testing your knowledge of what are the steps of this particular examination that I'm going to do. Suppose I'm doing a urine analysis. What are the steps of that? So you are very clear and cut, you know, you are knowledgeable, you tell him. Now they will tell, okay, now you show it to me stepwise. What did you do? That is what you have shown it to him. That is S. Now what he'll tell you, okay, now you interpret these results and try to analyze it. That is, you have to show how you did that and how did it come into play. How did you get those results and what all things apply to that? So this is how your whole pyramid has been designed, right? And in the end, when you are a master of everything, there are certain tests which will give you perform. That means P. P means that you have to perform certain things under supervision or perform certain things individually. So now the era has gone that if suppose I'm sitting in a college and I am in a medical school and I'm learning, and suppose if I don't understand urine analysis in biochemistry, I go back home, I sleep, and the next day I pick that up in the exams. Now the teacher has to make sure that you perform the test in front of them, and then only you will be called competent in that particular domain. Now that is beautiful. Why? Because I am not going home empty-handed. I know that finally I have to read this and show it to my teacher that this is how it is done. And the teacher will correct you. And then finally you will perform it. You will become a master of it. So as simple as that, know and apply. Nothing more. This is what competency education means. Right, Ryan sir? So I'll get you in. I think this is a lot of build-up that I've given over CBME. So I'll just ask you, what all things a student should know in order to get through logbooks, as well as what all they should do in order to maintain their logbooks and to become really skillful in later dates?
I think one of the things that the students are really lack during their MBBS is their logbooks. Most of them buy the logbooks at the end of the year and then start filling it up. I have signed so many logbooks over the years with just things written which absolutely make no sense, but you have no other choice but to sign it. But this CBME has also brought about a change in the way the logbooks are written, the way the logbooks, if any of you has already bought the logbook and has seen what is there, you will know that what the logbook that you have right now is totally different from the logbook that was there for the students before you. Because now, like Dr. Sanchit said, a lot of focus is given on performing skills. And once you learn skills, once you know how to do, you show how to do it, you need proof that this student has actually done this. He has done the skill that is expected of him. How do you know that the student has done? What is the proof? The proof is your logbook. And how is this logbook this time different for your batch compared to the batches before you? For every skill in the logbook, there is a date, of course, the date that you have shown it to the staff. And the next column after the date is a column which shows whether they have done that skill for the first time. If you're doing that skill for the first time, the staff will write F in front of that. If you have done it earlier and you have not done it well, so they will ask you to repeat it. So if you're doing it, for example, they're teaching you how to place a Ryle's tube. A Ryle's tube is also called as a nasogastric tube. So that tube goes from the nose into the stomach. So these days, you don't have to place the tube in a patient. Your colleges will be equipped, hopefully, with a nice skill lab where you can place a Ryle's tube in one of the mannequins. So the staff will stand there and will be assessing them. So if you're doing it for the first time, the staff will write F against the skill in your logbook. You're performing it for the first time. If you've done it earlier at that same sitting, and you're doing it now second time, didn't do it well the first time, so you've done it, and second time you do it well, then they write, it's a repeat of the procedure, so they write a R against that skill. Third thing is, you did it for the first time, your staff was not happy with it, they asked you to do it again you did some mistake, they asked you some questions you were not able to answer, they will send you for remediation. They'll say, go home, no, it's okay, study it well, and come back again at a later date, and I will give you the date at which you can come. And when you come again at a later date and you do it successfully, they will write RE, remedial, and you've done it successfully. So that is how the logbook is different. There's another column where as you do the procedure, the staff will enter saying M, that the student has met the criteria. The patient, the student has done it well. So M, he meets the expectation. So second one is if he has not met the expectation, below expectation. So B against that skill. And then if you're really good, you have done your homework and come supersedes the expectation. So there is a column even that where the staff will write that you have done better than what was expected from you. From your level, you have done better than what was expected. So there will be a remark for that as well. So that is why your logbook is very, very important. So what, you have done it well, you have got R, you have got RE. Does it matter? Yes, it matters. This logbook is gold. You know why? Tomorrow, you finish your MBBS, you want to go abroad, you want to go to the US, you want to go to the UK, they will ask you, what are the things that you have done during your MBBS? You can stand there and say to them, yes, I have done Ryle's tube insertion, I have done Foley's catheterization, I have put an incision on the abdomen as an intern. Where is the proof? They'll ask you. And that is where you hand over your logbook and tell them, these are all the things that I've done over the course of my MBBS. And that is a proof because it is cross verified by the staff signature will be there. It is a proof of everything that you have done in your MBBS, throughout your MBBS, besides your exams. Of course, you'll write your exams, you'll pass your exams, and only then go abroad. This is added. You have done some procedures. So these are the things. That is why your logbook is so important. You're at the beginning of your first year. Make sure that your logbook is entered well. You have done all the procedures so that you don't have a problem at the end of your MBBS when you're going somewhere abroad. Everything in place. Rather than then searching for all the procedures that you have done over the last 4.5 years, trying to enter them, trying to do them, trying to go to the staff and getting it signed. So instead of that, start it from right now. It will help you go a long way once you finish your MBBS. So that is in brief about the logbook. I will now hand over the back to Dr. Sanchit, and he will tell us about the next aspect of CBME.
Yeah, and as Ryan sir said, I don't want to load you guys up because there is a lot of things in CBME, and CBME has got a lot of integrated learning. As I told you, that you will not be alone. Your teachers are always with a headlight on top of you through this module, right? So we are going to have yet another session of CBME where we are going to cover about especially the integrated part out of CBME, how our app is useful and what all things we are giving and how we are teaching in the app. So what exactly is this integrated teaching, how these horizontal integrations work, how the vertical integrations work, and how you should approach a particular subject in reading. And there itself, I'm promising you that I'm going to give you certain case scenarios as well. That suppose if you're reading appendix, and how will that appendix work with you in surgery when the person comes your appendicitis, and how a pathology will work into play when you're reading it. So multiple subjects orienting together, these are called as integrations, and I have a special session on that with Ryan sir, where we'll be discussing about how integrations work with specific examples of certain diseases, of certain case scenarios, which we have already formulated, right? So now we will like to have questions from your side, because I know that you guys are just new. You've got so many questions inside a novice brain, and that all scares, that scare inside a first year medical graduate is always there. Because I can believe if I was on your seat, I would have been lost. I would have been thinking about 10,000 things every day. And even question myself, is it worth it to be a doctor by so many means? Because I'm traumatized listening to so much. First my teacher, and then now to me and Ryan sir. So let me take up some questions from your side. So
Yes,
over to you, Aishwarya. We're open for the questions for today.
Also, I would like to add that in the next session, we'll also be discussing about early clinical exposure. I think that is another aspect students are always interested. We want to go to the hospital. We want to see what is happening there. How is dissecting a cadaver going to help us in treating patients? Cadaver, what is the point of sitting in the dissection hall and dissecting formalin cadaver in a formalin room? So we will discuss about that as well. What is early clinical exposure and how it is going to help you in the next session. And like Dr. Sanchit said, now the floor is open for any questions that you want. And don't hesitate to ask any questions. Dr. Sanchit and me are open to answer any query that you have. There is nothing called as a silly doubt or a doubt, useless doubt. Every doubt is a doubt which has to be cleared.
Thank you so much, Dr. Ryan sir and Dr. Sanjit sir. It was indeed a pleasure listening to both of you. So, guys, it's as both of them said, it's Q&A time right now. I request you to raise your hands in case you have a question or a query to ask our amazing tutors present here. So, kindly request, raise your hand so that I can guide you guys for the question. Please feel free to ask. Yes, sir.
As you're thinking about the questions, I would also like to tell you guys to go through our previous sessions and see if you all get any doubts there as well. And you all can ask us anytime in the future sessions as well, future Polaris talks as well. So do that. It might help you in some way. Yes, Dr. Aishwarya, over to you.
Yes, sir. Thank you. I think I'm waiting for the questions. Please feel free to raise your hand so that you can just get your question answered from them.
Because when I entered medical school, I had 10,000 questions in my head. First question was, why am I here? Or what am I supposed to do here on these benches?
Oh, great. Okay. Let's make it more interesting, I feel. I think, so the first person who is going to raise your hand for a question or even to share your, or experience, we can offer them a 3-month free subscription, I think. Sir, what do you say?
If I would have been like this, then I would have been every day here.
Okay, so I'm here. Yes, I'm here offering you a 3-month free subscription to the contents of Dr. Polaris for your respective academic year. So guys, grab this offer. You can either ask a question or share your experience as what Ryan sir was asking. This is your chance. Come on. Let's make it more interesting. Yes.
I think everybody is serious.
Everybody is serious.
Then what we'll do is, since Aishwarya has said that she is ready to give a subscription for the student who asks a question, I will give an opportunity for somebody to get that subscription. I will call out a name, and if that student responds and tells me how the MBBS journey has been so far, no need to switch on the video. You can just switch on the mic. I will Aishwarya can give that subscription to that student. So I've seen the name now. So randomly, I'm going to call out Neha Grace's name. Come on, Neha. You want a subscription? Switch on your mic and talk.
Okay, we are waiting for you, Neha.
By the way, I don't know who Neha is. I have randomly picked the name. So no partiality. Come on, Neha.
Hi, Neha.
Yes, hello everyone. My name is.
Welcome, Neha. Yes, we are eager to hear your story. How's your first year going?
Your story or your doubt? Anything will do.
As Neha, of now, all the lecturers are like really friendly and they're like open to doubts and everything. They're accepting everything and they're listening to us. And yeah, the new CBME and all of that, they have explained it to us also. And we felt at ease when they were explaining it to us. And the seniors over here are also really friendly.
I'm telling you, you are in a gem of a medical college. Because this is a gem of a medical college which exists in this country, in which good seniors as well as good teachers exist at the same time. Who are so friendly.
Which college are you from?
I was there.
Neha, which college are you from?
I'm from GMC Nalgonda.
Okay, excellent. So how many days have you finished as first year MBBS student?
I think about 15-20 days.
So far, which is the subject you like the most?
Personally, I prefer anatomy, but biochemistry was also really good.
Okay. How was your first day in the dissection hall? I'm grilling you like a viva now.
We actually not start dissection yet. We just went to the dissection hall, but that itself was pretty tense moments.
Okay. Did
If you
anybody
like
faint?
anatomy, then definitely you have the sparks of somewhere inside your brain that I want to be a future surgeon. If I'm not wrong.
Yeah.
Yes.
I want to be a plastic surgeon.
Oh,
I want to be a plastic surgeon. By the way, you have already decided plastics. You have decided the 18-year journey that is already lying in front of you.
Yes. Great.
Great,
So-
great,
So,
great. And
Neha,
we wish you all the very best. And excel, keep excelling, and keep doing well. And I hope that you enjoy your MBBS journey. Don't forget to enjoy, because that is one thing that you should do. Just don't read and read. Enjoy it as well.
Yes,
and
sir. Thanks so
journey
much.
to plastic surgery is a long one. So go step by step. It's good to have the goal, but go step by step and make use of every lecture, every class. And don't be surprised. Somewhere along the journey, you might your interest might change um, depending on the subject. So open to it. It's good to have a goal, but take it one day at a time.
Yes, sir.
One day at a time.
Yes, sir.
Okay.
Thanks,
Okay.
sir.
Thank
Yeah.
you, Neha. I'll definitely get back to
So
you
Neha,
with the
has got a free
subscription.
subscription.
Thank you so much, ma'am.
Congratulations.
Thank you so much,
Neha,
sir.
you can thank me for that.
This is a lucky draw.
Yes. So that was indeed a very pleasant thing, because we could select someone out, and she shared her experience. And I think the students these days are really, very focused. I just had an intention of doing well in my MBBS when I got in first year, but they have even chosen their super specialty right now, like very focused and very prepared. Great, and kudos to all of you guys. So I think, sir, then can we wind up the session for today?
Sure.
Yes.
Sure.
Yes, so I think we had a brilliant time, and I would repeat again and again, or maybe a wow to both of you, because it was a very informative session, and I definitely feel that all the students who are present here today also would have felt the same. And we are looking for more amazing sessions from both of you. Thank you so much.
And we have something waiting for you. So the next session will be more of scenario based. So me and Ransa have created certain scenarios so that ingrains that thought inside you what exactly CBME learning is. So we will take you through a journey of case scenarios of how Dr. House thinks, how McDreamy of Grey's Anatomy thinks, and how these things actually come into play in reality, and how you need to know and what you need to do. So our next whole thing will be focused on integrated learning and early clinical exposure. That's what we are going to discuss with you, and what all you need to know about in these particular scenarios. Right.
Okay. Neha, I repeat, please do contact us tomorrow. We'll be definitely getting back to you with the subscription on that. And guys, we will be live on every Wednesday, 8 p.m. sharp with our super tutors, and we'll be discussing different topics, which is of really, your interest. So hoping to see you all for the next session as well. See you all for the next Wednesday. And thank you so much, sirs. Thank you everyone who are here today. And have a nice day. I mean, good
Thank
night.
you so much for having us.
Thank
Thank
you,
you.
everyone. Thank you.
Bye, sir. Bye.